Hi, I'm Dr. Lorenzo Cervantes. This video is an overview of refractive surgery, a group of procedures aimed at reducing your need for glasses or contact lenses. When you come in for a consultation, one of the first things we'll talk about are your goals. What are you trying to improve? How do glasses or contact lenses affect your daily life? What kind of vision are you hoping to achieve? By understanding that, we can decide whether refractive surgery makes sense for you, and if so, which option is best. There are several types of refractive surgery, and each is suited to different types of eyes, prescriptions, and lifestyles. Let's go through the most common ones. LASIK. LASIK is probably the most well-known procedure, even though it hasn't been around the longest. I had LASIK myself done in 2011, and it's been working out really great for me. Here's how it works. We numb the eye with drops, we create a thin flap on the cornea, a laser reshapes the underlying cornea to match your prescription, then we reposition the flap, and that's it. The whole process takes about 30 minutes in our laser suite, which is right here in our office. There's no pain, just some pressure and maybe light anxiety, which we manage with a mild oral sedative like Xanax and relaxing music. After LASIK, most people feel itchy or scratchy for the rest of the day, so we ask you to go home and take a nap. By the next morning, vision is usually clearer and the eyes feel much better. Recovery is quick. You'll use eye drops for a week or two, and I'll see you for follow-ups the next day, the next week, a month or two after, and occasionally afterwards as needed. There can be ups and downs in vision during healing, some good days, some blurry days, but most patients stabilize over the first few months. PRK. PRK is similar to LASIK, but without making a flap. Instead, we gently remove the surface layer of the cornea. We then reshape the exposed cornea using the same laser, and because this creates a surface abrasion, we place a bandaged contact lens for comfort during the first week. PRK has a slower recovery than LASIK. Vision is blurry at first and gradually improves over weeks to months. You'll use drops for closer to 2 months. I'll see you the next day after surgery, a week afterwards to remove the contact lens, then monthly as needed during recovery. Why choose PRK? PRK is a safer option for patients who may not be a good LASIK candidate. For example, those with thinner or weaker corneas, high prescriptions, or very dry eyes. EVO ICL, implantable Collamer lens. Another great option for patients with high nearsighted prescriptions or those looking for a reversible procedure is the EVO ICL, a lens implant placed inside the eye. It goes between the iris and your natural lens in a space called the ciliary sulcus. It contains your prescription, no laser reshaping is needed. The procedure is done in an operating room, you're awake, the eye is numb, and you'll get some IV sedation to keep you relaxed. It takes about an hour and you go home the same day. Recovery is very fast, often faster than PRK and comparable to LASIK. And if needed, the lens can be removed, making this a reversible option, unlike LASIK or PRK, which permanently reshape the cornea. Refractive lens exchange. Refractive lens exchange is for patients who are a little older, typically in their 50s or older, who are starting to need help with both distance and near vision. This procedure is similar to cataract surgery. We remove your natural lens before it becomes a cataract and replace it with a synthetic intraocular lens, or IOL. We use the same advanced lens technologies that we offer cataract patients to match your lifestyle and goals, including options that reduce your need for reading glasses. Refractive surgery is not for everyone. It's not about achieving perfect vision. If you're happy wearing glasses or contact lenses, or if you don't wear them at all, refractive surgery probably isn't necessary. All surgeries carry some risk. The most common short-term effect is dry eye, which happens to some degree after any vision correction surgery. Symptoms of dry eye can include grittiness or irritation, redness, fluctuating vision, or sensitivity at night. That's why it's important to manage dry eye before surgery, especially if you already have symptoms. We'll go over instructions to help with this, including lid hygiene, warm compresses, remembering to blink during screen time or reading, and using preservative-free lubrication drops. For some patients, we recommend a more advanced dry eye treatment plan before surgery to minimize post-op dryness. We can go over that in more detail when you're here. Even with perfect surgery, aging still happens. In your 40s, everyone starts to lose their near vision. This is called presbyopia. Eventually, everyone also develops cataracts as the natural lens hardens and yellows with time. So while LASIK and PRK create permanent changes to your cornea, your natural lens will keep aging. That means your prescription could shift over the years, especially for reading. And no matter which procedure you have, halos and glare around lights at night are possible, particularly in dim lighting or when the eyes are dry. Patients with high prescriptions tend to notice this more. I had LASIK myself in 2011, and I do experience a little starbursting and halos at night, but honestly, it doesn't bother me. It tends to be worse when my eyes are dry, and I usually only notice it when I start talking about it. If you're interested in pursuing refractive surgery, here's how it works. First, the screening visit. We take measurements and talk about your goals to see if your eyes are compatible with refractive surgery. Second, the preoperative evaluation. If you're a candidate, we dilate your eyes and take more detailed measurements in their natural, relaxed state to finalize the plan. You'll have the procedure, either in the laser suite or operating room, depending on the type, and go home the same day. Lastly, follow-up care. I'll see you for all your post-op visits, guide you through healing, and once you're happy and stable, you'll return to routine eye care with your regular eye doctor. I'll always be available if anything unexpected comes up. I hope this gave you a better understanding of what refractive surgery is all about. Thanks for watching. I look forward to meeting you.